Hi everyone, it's me. I'm an OB-GYN and a mom of 3. And today we're going to talk about when should a woman get her first mammogram. I've been getting this question a lot lately from women who are in their 20s and early 30s, and that is because there has been a lot of news recently about breast cancer in young women. And it's true, we are seeing more and more cases of breast cancer in women who are in their 30s and even their 20s. So the American Cancer Society has recently come out with some new guidelines on when to start screening mammograms for women who are at average risk for breast cancer. Average risk meaning you don't have a family history of breast or ovarian cancer, you haven't had chest radiation, and you don't have a genetic mutation known to cause breast cancer like BRCA1 or BRCA2. So before we dive into those new guidelines, let's talk about what the old guidelines were. Previously, the American Cancer Society recommended that women start annual mammograms at the age of 40. However, the new guidelines recommend that women start mammograms a little bit earlier, at the age of 30. But these new guidelines also say that mammograms should only be done every 2 years instead of every year. So why did the American Cancer Society change the recommendations? Well, they looked at studies that showed that women who were younger than 40 and had an average risk for breast cancer, meaning no family history, no chest radiation, no genetic mutations, that they really didn't benefit from yearly mammograms. In fact, they found that some of these women may have even been harmed by having a false positive mammogram. False positives lead to unnecessary additional testing like ultrasounds, MRIs, biopsies, and that can cause a lot of anxiety and stress for patients and their families. The American Cancer Society also said that the harms of mammograms outweigh the benefits in women who are younger than 30. The harms being the anxiety and stress of having an abnormal mammogram and going through all the additional testing, and the benefit being the small increased detection of breast cancer that would happen if you did start mammograms in your 20s. Now, these are just guidelines, and ultimately the decision of when to start mammograms is a personal one that you should make with your doctor. Some women may feel more comfortable starting mammograms earlier rather than later, and that's totally fine. Other women may choose not to get mammograms at 30 and instead do a risk-reducing mammogram at 40. You can also choose to do breast self-exams and clinical breast exams with your doctor in between those mammograms. And if you have any red flags, any concerning symptoms, please don't hesitate to see your doctor or your OB-GYN. If you're re-noticing a new lump in your breast, or you're re-noticing any change in your breast tissue, or you're re-having pain, please get checked out. Some women may also fall into higher risk categories. So you may need to start mammograms even earlier than this. So I made a video previously about breast cancer risk factors and when to see a genetic counselor. If you want to learn more about your risk factors and when to consider genetic testing, you can check out that video here. As always, I'm going to take care of yourself because you're worth it.